Hey, chiropractors, are you maximizing your chiropractic practice? Hi, everybody. Welcome to the KC CHIROpulse Podcast, brought to you by ChiroHealth USA and CATS Consultants. I'm your host, Dr. Michael Perusich, and I'm here today with my special guest, Heather Simmons-Ellis from CHUSA, from ChiroHealth USA. I'm so excited you're on here today.
I am too. Thanks for having me.
Absolutely. So we talk about how to develop the right fee schedules and do the right things in practice and how to maximize profitability. So I'm super excited that you're here because we talk about developing those correct legal fee schedules all the time. And of course, ChiroHealth USA, your name always comes up because we love what y'all are doing. So I'm super glad you're here. So why don't you just give a 50,000-foot overview of what CHUSA is all about, and we'll just dive in here.
See, the best way for me to explain what CHUSA is all about is, and I am very passionate about what we're doing today. I love to help others just maximize what they can do within their practice. But CHUSA, ChiroHealth USA, is about profitable discount strategy.
Okay,
That's
I want you to say that again because that is so important. All right,
it.
everybody, seriously,
Yeah.
listen up to this really close.
ChiroHealth USA is one of the simplest things any practice could do, but it is truly about profitable discount strategy.
So I'm going to stop you right there for just a second. So we can have a discounted fee plan in our practice, but we can still have profitability.
I love that because discounts don't equal broke.
Exactly.
They
Thank you.
don't. Yes.
Yeah. So I hear doctors say all the time, I don't want to discount my fees. It's because you're thinking about it all wrong.
Okay, that's the part that tickles me the most. And seriously, this is one of my favorite topics. And I'll say, are you in network with insurance? Yeah. I'm like, Uber, you're already taking a discount.
Charge one. And it goes down that discount increases every
Oh,
year.
yeah. It's a hot mess. And I hope we talk about some of those strategies today for
Absolutely. I would
practices.
love to.
Mhm.
I'd love to. So bringing CHUSA into a practice. So this is my perspective. This is my perspective, and I'll let you just run with this. But my perspective is not only does it shore you up from a compliance standpoint, so you're not doing all these weird, crazy discounts that you really shouldn't be doing. You truly have a legal discount program. And I'm going to tell you a couple of stories as we go today, but you create a legal discount program. So you're covered compliantly there.
Mhm.
And then you've got this ability then to show patients that, hey, your insurance is great, but it doesn't cover everything. And we all
Right.
know that. And the patient knows that. And so here we've got this secondary plan that, in my opinion, really helps set you in a unique position, typically in the marketplace, because
Mhm.
it gives you a very healthy competitive advantage.
Yeah. And it's discounts, but it's compliance and it's a strategy and it's profit and patient retention. Like there's so much more that go into doing it. It's a profitable discount strategy.
Very much. And when you employ it correctly, when you build it into your practice correctly, when you develop not only the understanding of how it works, and I want you to talk about that, but once you have the understanding of how it works down and you develop the communication strategy along with it,
Yeah.
and this is a lot of what we spend time, and I know you do too, with our clients, really working with them on how to make this work. But the level of patient experience and
Mhm.
satisfaction absolutely goes through the roof. And
Mhm.
here's what it does. So in our mastermind program right now, we're studying this whole idea of building loyalty and through authenticity.
Ooh.
And this just speaks to that because he's right in on one of those ways that you really build loyal patients, and it's through patient satisfaction and great patient experience. When you tell a patient that you've got their back covered on their expenses and you're not trying to get in their pocket and do weird, crazy things, they love you for it.
Mhm.
And here's the cool thing. They go out and then they go tell 100 other people about it.
Yep.
And all of a sudden you got all these referrals coming in. Talk a little bit more about that and maybe what I don't want to get the cart ahead of the horse here, but maybe a little bit about what some of the fears are that we see doctors having of implementing a program like this.
So a lot of times I see a doctor of chiropractic use their DC for doctor of creativity.
I love that. That's great.
there are rules and there are regulations, and I really don't want to go down the rabbit hole of rules and regulations because that's, I think, a whole other topic that we could spend a lot of time on.
Hmm.
I've been doing this for almost 13 years. I love what I do. Love what I do because I get to make a difference through a discount network, right? There's a lot that comes to it. But at CHUSA, ChiroHealth USA, we've worked with over 7,000 doctors. And one of the things that I've seen throughout that process is that this profession loves to give
Yep.
because we have a servant's heart. But a lot of times we offer too many discounts thinking that they're helping the patients. But in reality, you're actually hurting the business, something
Yep.
that you've worked so hard to create. Again, it does start with a profitable discount strategy. It's important because if your practice is healthy, then it's one less thing you have to worry about, and you can go take care of your patients in the right way. It gives you the competitive advantage. So setting your fees is super important. That allows for the profitability. Just because you're a DC, there's nothing in the books when you graduated and you obtained that license that said that you could not be profitable and still help patients. So
Amen.
I think that's important. It helps you with professional development, investing in your own development at your seminars, your certifications. It's a win for both the doctor and your patients. A patient satisfaction, as you spoke about that briefly for a second, was if you can look at setting your fees right and having a successful practice, that allows you to focus on providing an exceptional patient experience. You're not constrained
Absolutely.
by your financial concern. This is all going to lead to better patient satisfaction, positive reviews, positive, better patient retention, expand your horizon. I know practices all the time get stuck with, I can't grow. I can't get past where I'm at. All of it starts with what I would call a healthy foundation. There's a lot of tools that we have in our belt here at ChiroHealth USA about setting your fees. We never tell you how to set your fees as far as what to set, but it is just knowing the resources, gaining the information, and growing from there with benefiting again the chiropractor, the team, and the patients. It all starts with profitable strategies. Include discounts in that, if you will.
One of the things I love about what you guys do is you really drill down on helping doctors build that good global fee strategy. And then I know for our clients, we come in then behind and help them refine that strategy so that they have real profitability in their practice, whether it's on a cash service that goes through ChiroHealth USA or it's on their insurance services.
Yeah.
And here's something, and I know you'll key in on this. Here's something we see a lot in this profession. We see random fee strategies. We see doctors go, "Oh my gosh, the clinic down the street's doing a $29 deal. We need to do 27."
Mhm.
And it's this big race to the bottom sometimes.
Yeah.
And when we compete on price, we need to be able to set a good fee strategy, and everybody's fee should be different because everybody's profitability level needs to be different. And CHUSA for me is one of those foundational components. And we use this big time in our practice, is one of those foundational components that allows you to set your fees in a profitable way, still offering a discount to patients. So patients feel good about what they're doing, but it's then set it and forget it for the doctor.
Mhm.
And that way you can then focus on patient care, knowing that you're not playing let's make a deal all the time. Your
Right.
front desk people know exactly what to charge and what goes to insurance, what comes directly from the patient. The patient understands it. And you couple it with some of the new rules that we have today, like No Surprises Act, where we have to show the good faith estimate. Oh
Mhm.
my gosh, mind blowing. It's the perfect scenario to have the right structured fee strategy, use your term, the right structured fee strategy. So you actually go home at the end of the day with profit in your pocket. And that's what we're all here for. Yes, we have the servant's heart to help patients, but we're also here to drive profits too.
We tend to overcomplicate the process.
We do.
We have team members. I don't think, and I spend a lot of time at seminars with docs and with the team members. And one thing, let me drive this home for a second too. One little word can change a lot for your practice, especially when it comes to what I call behind the desk. So it's really easy for us to call them staff, by the way, because that's the generic term. But I always say staff is an infection. They're your team, because they're on the same playing field as you, hoping to get to the same outcomes or push you over the line so it's a win. So I always challenge practices when they say staff, I'm like, no, it's team, because that
Yeah.
develops a
Use that
whole
term
other
too.
mentality for your team to support you and your goals. Because if they feel a part of something, a lot of times doctors miss that point. Their team is doing a lot of heavy lifting. And you could be the CEO, the chief everything officer, not have any team members. You are doing all the heavy lifting. You're the
Sure.
chief bottle washer. But if you employ a team, wow, do we really need to understand what all falls on their plate? And are we making their day more complicated by putting our foot in the financial conversations?
Exactly. Exactly. Doctors need to stay out of that as much as they can.
Doctors
Honestly,
don't like when I tell them that. I'm like, why are you having this guy? You're the good guy.
we're supposed to stay that way. And you bring up a great point. When we sometimes create these crazy fee strategies that are all over the place, we don't really think about how that affects the entire team. We're so focused on trying to make the patient happy when we do that, but we need to make sure that it's also effective and honestly simple as
Mhm.
can be for our team to be able to affect, because they're I call them the profit makers, because
Yeah,
that's what they do. We as the doctors deliver the service,
right.
but if your team is at the front counter collecting, they're the profit makers.
Making it rain.
Yeah, and so they're the ones that have to have the financial conversation with the patient. They have to help the patient understand the value that they're paying for and help them understand that the fees they're paying for your services make sense.
Yes. Yep.
And this you guys out there, this is where ChiroHealth USA comes in such a strong way to really help you with this. And it's not it, it's a whole bunch of things. It's the way they've set the program up, the way they help you guide you through it, the way they help you develop your communication for the patient,
Yeah.
and just getting you that deep understanding. Everybody gets to that point with you guys, which I love because I get the calls all the time. Okay, you told me to call ChiroHealth USA. I get it now.
Mhm.
And the light bulb goes off. And then boom, they're off and running with it. And they're like, oh my gosh, this is the greatest thing since individually wrapped and sliced cheese. You can tell Dr. Foxworth I said that.
It's we've been around for 16 years. So it's not 30, 40 years for ChiroHealth USA. There's a specific model that we operate under. And I think it's important that I hit this home too, because it's a DMPO model. So
Yep.
anyone can Google what a DMPO is. It's a discount medical plan organization. And we operate under that. But I looked back during COVID, if I can say that word, and I scaled back and said, there's got to be more to what it is we do than take a practice who's raised their hand and said, hey, I don't think I'm being very compliant now. I've got this cash fee. Can you help me out with that? And traditionally, it would be, all right, let's look at that and let's just incorporate some pieces and move forward. During that time, literally took a step back working with a few practices and thought, there's more to this. And I began looking at just how the practice can grow. What are some of the biggest hiccups that they run into, the concerns, the roadblocks? And it's that practices don't know their numbers. They don't know their numbers.
Oh, you're talking my world now. Okay. What?
We got to work together.
Oh
I'm
yeah,
so
totally.
passionate about this.
I want you to hold that thought for just a second because
Yeah.
I'm getting the red flag. We gotta take a message from our sponsors real quick. So everybody, we're talking about ChiroHealth USA and how you can bring a discount medical fee plan into your practice and create that legal fee structure on the cash side of your practice. So this is mind blowing. So stay tuned. We'll be right back.
So we all feel it. Rent or dining out, gasoline or movies. As a matter of fact, the dollar is not going as far for a whole host of reasons, and it's impacting everybody regardless of your financial situation. Did you know that 38% of the overall population is having to reconsider how they're spending their money just to afford the healthcare they need? And if you break it down further, 26% have actually delayed the healthcare that they need, including going to see you, the chiropractor. So here's what we need to know about the breakdown in demographics. You would think that someone who's making $120,000 or more would be continuing their care right now. But the actual number is 18%. 18% of that group is actually putting off healthcare. And that's a group of people making six figures. When you take that same information all the way down to a group making 40,000, that number is much higher. It's closer to 40%. So it's never been more important than now to make sure you've made it easy for your patients to come see you, that you have choices for them, and you understand what they're going through at home. We want to make sure your practice thrives during this time, and we encourage you to learn about what ChiroHealth USA can do for you and your practice, and making it easy for patients to see you and continue care.
All right, everybody, we are back. Thanks for tuning into the KC CHIROpulse Podcast today. We're talking with Heather Simmons-Ellis from ChiroHealth USA. Drum roll, please. And we're talking about how to set these fee structures. And you started in on this road of numbers, and I'm a numbers guy. So let's talk about the fact that practices don't understand their numbers so oftentimes.
I would say you'd be amazed, but I think you totally
Mm.
get what I'm about to say. And we work with all practice types, right? We are nationwide, and I'm not specific to one region. So when I say I've seen it from Florida all the way to New York, to California, to Texas, I have seen the numbers. And there's a lot of data to back this up too. When I talk with practices, I'll say just simply, when's the last time you reviewed or updated your actual fees? Oh gosh, it's been, so I know enough to make me dangerous to look at some of these numbers and go, that's definitely not, what are you doing? And let me give you an example. This very sweet chiropractor out of Illinois, I looked at her fees and I thought, oh, wow. How long have you been in practice? She said, 24 years. I said, when's the last time you updated your numbers? She said, I hadn't touched that since I opened my doors 24
Yeah.
ago. I said, you know what's sad? If Medicare was going to reimburse us as a profession for everything, you're below what Medicare would reimburse you. It's crazy. 7 to 10 years, typical practice, 7 to 10 years. You should be looking at your fee structure twice a year, minimum.
At least.
So they're so afraid to make the change because they're afraid that they'll lose all of their patients. When in reality, if you make the small changes over time, your patients understand and appreciate the value of care that you're offering. Look at your actual fees. The other thing too, Dr. Michael, is that they don't know how to update their actual fees, the resources, the things that are available. This is definitely where I do get on my soapbox, and you can tell me to jump down at any point.
I may jump up there with you.
And then we complain oftentimes about insurance reimbursement is just very poor. I know it is.
Getting poorer.
It's getting worse. But one of the reasons why is because they use our data against us. They use that against us. So when you're saying insurance reimburses me $12, so I only bill $12, now they're going to reimburse you $8. Why? Because you didn't value your services to begin with. And now they have the data to support it's not worth paying you that.
And that's what I call the race to the bottom.
Oh,
We're all looking in the wrong direction. We see this all the time too. I can absolutely support what you're saying. We see clients who, and this is one of the first things I ask somebody when they become a client of ours is, when was the last time you raised your fees? And I hear this all the time. Oh, I'm proud to say it's been 15 years. How is that a pride thing? How's that a pride thing? And then we show them their profitability margins.
wow.
Because we do these deep dives into deep statistics, and they're like, oh my gosh, I had no idea I was losing $5 on every patient visit. Yeah, you didn't realize it because you're living out of things like AR and enough new patients. When you have 80 or 90 new patients coming in the door, sometimes you miss some of these things.
Right.
And okay, we got to get your fees under control. And then we look at fees at least, like you said, at least once a year, sometimes twice a year, sometimes 4 times a year.
Good.
Because sometimes their fees were so low that we've got to ratchet them up fairly quickly to get them profitable again. And then when we come in behind with a plan like ChiroHealth USA and help them build that side of the fee strategy as well, then they're shored up for when maintenance isn't covered, for example, when decompression's not covered. when muscle stem's not covered. Now your patient's got backup coverage. And for those of you just listening, not watching, I'm using air quotes here. And so it becomes this real win scenario. And all of a sudden the patients are just loving you for this.
Mhm.
And here, to me, here's the best part. So I hear a lot of doctors say, "Oh, I don't know. What a patient's going to think about ChiroHealth USA?" I laugh. Okay. So I'm gonna tell you a story to illustrate this. Not too long ago, I called my eye doctor's office, and shamefully I hadn't been there in a while. And they said, "Now, Dr. Michael, what kind of insurance do you have?" And I said, "I have Blue Cross." And they said, "Oh, you're so lucky. It covers nothing in our office." And I'm like, "Okay." Now, I knew where this was going, but she immediately said, "But we are a provider on a discount optical program that's going to save you a ton of money. I'm going to send you a QR code. If you sign up for it now, when you come in, you'll already be saving. Here's what you're going to save. You're going to save more than what the plan costs." A- And I'm like, okay, this is the panacea of perfection,
Mhm.
because when you tell me my insurance doesn't cover, but you have a backup plan for me,
Yep.
I'm loving you.
Yep.
And I've told everybody in the world the story. So I'm sure I've referred a lot of people to the eye doctor, but this is what your patients are going to think. They're going to think, "Oh my gosh, this is fantastic."
Mhm.
So don't
Absolutely.
be afraid of this. Look at this as this is a one of the biggest win-wins I think we have in our profession right now.
And we also pick up on a lot of marketing. We're going to lower our fee to $29 or $49 for a new patient visit. I always say these marketing companies are not compliant. They don't know the rules and regulation. Their goal is to get feet through your door, where that is fair. But when is the last time you went online and saw your primary care physician
Mhm.
advertising a new special? Your dentist, for that matter, if it's not one of those big franchises that definitely try to go down that path, an OBGYN, a
Right?
neurologist.
Yeah.
How would you feel if you got on social media and you're scrolling through and you see a neurologist discounting their first visit to $49? Who said we had to do that as a chiropractic profession?
We'll deliver your baby for $49.
Right.
I'd
Why
probably, I'd not probably, I'd run.
Exactly. Why do we have to do that as a profession? So, as I talk about a profitable discount strategy, it is not to discount yourself out of the market, because a
No,
lot of times that's what's happening. As I respect so many of those marketing companies and vast there as coaching groups, things out there, you really need to look at your foundation. What is the cost of doing business?
thank
Because
you.
you don't want to sign contracts with insurance companies just to be in network.
Right.
Understand the demographic of your patient location. For us, and if anyone's ever curious, come visit us in Flowood, Mississippi, if you want to see what the Blue Cross Blue Shield campus looks like, because they don't hesitate to get out there and play soccer or tennis. So in Mississippi, if we're wondering where some of that money's going. It's beautiful. But our practice, when Dr. Foxworth had it, was just a couple of blocks from it. And our office at ChiroHealth USA was almost across from it. So we could
Right.
see all of this
I
day
love
in and
it.
day out. But when we stripped back, oh, we're frustrated with insurance and all of this kind of comes into play. What we needed to do was, an analysis. And there's some pretty incredible reports that these EHR systems will produce for you if you know how to get to them and run those reports. So you've got that within almost every EHR. It's going to give you statistics. But that's ultimately what we did was we ran those numbers. Who was our best, worst reimbursement? When it comes to that, it was for us, it was Blue Cross. And we're thinking, holy smokes, what do we do? We're going to have to drop Blue Cross, but they're literally across the street. But here's what we found is they were our best patient retention. So it is understanding your numbers, not just your cash fee, all of this, but truly understanding your insurance contracts. Just it's called playing the game, but no one says value yourself over here as if you were offering a pedicure.
Exactly.
Because I will tell you right now, I don't mind dropping $100 for my nail appointment.
No, of course not. How much do we drop for a cup of coffee anymore?
Oh my gosh. I even use that analogy. Practices will come to me and say, oh, but ChiroHealth USA is $49 a year for the patient. I was like, yeah, okay. It's $49 a year for the patient and their family. And if I reduce to ridiculous just a little bit, it's less than a cup of Starbucks coffee a day,
Yeah.
right? A month. I just had a Starbucks coffee right
Oh,
here.
yeah.
So
I've totally
less than
lost.
that for 1 month, I could go drink all the Starbucks I want and still pay more for Starbucks than I would for affordable chiropractic care.
Exactly. And when you set the fee structures correctly, you can show how ChiroHealth USA plan is going to save the patient more than that $49. And that's the point. Don't get stuck on the membership fee.
Don't,
And I
don't.
could go all day long on the membership fee. That's part of what creates retention. But don't get stuck on that part. Get stuck on how it's helping the patient and helping the patient stay in care. And doctors out there, isn't that our whole goal? Is to get patients used to the chiropractic lifestyle, make it
Mhm.
part of their lifestyle. And ChiroHealth USA really opens the door to that hugely. Is that a word? Um,
Today.
it is today. My story's like Dr. Foxworth in his practice. Many years ago, we were looking at insurance reimbursement go down the tubes, and Blue Cross eliminated, they didn't eliminate, but they moved 97014 forward to patient responsibility. And we thought, oh my gosh, the world's gone to,
It's ending. It's done.
it's ending. How are we going to manage this? And so we just sat down and thought rationally, okay, why can't patients pay for this? And we were already a ChiroHealth client. I don't think at that time we were really using it as much as we should,
Uh-huh.
but we came to the realization that, hey, wait a minute. If our patients are on ChiroHealth USA, they can save $5, I think it was, on muscle stem. So they're saving money. We'll show them that, hey, your insurance company doesn't cover this anymore, but look, this plan does. And everybody was happy. And we're like, holy cow, we can get off of insurance. And I'm not saying you have to get off insurance, everybody. So I get emails sometimes of, you're telling everybody to get off insurance.
No.
No, I'm telling you that you live in an insurance and cash world
Yep.
today.
Mhm.
And that's not a bad thing. It's actually a good thing from a profitability standpoint. But we learned that just shifting everybody like that, and then medical necessity comes along, and all of a sudden, maintenance isn't covered anymore. Probably
Right.
never was, but maintenance isn't covered. And so now patients are already set up on their Chiro Health plan. And we saw patients staying in care, and retention went through the roof. Heather, our retention was 96%. It
Gee,
was
I wish I
huge.
could get that from every that just you can't see it here, but like
I
the
know.
goosebumps.
It was amazing. And it was Chiro Health USA that got us there.
And so, well, to elaborate a little bit further, 95% of our providers, when we surveyed them, said that they used ChiroHealth USA as a way to navigate getting out of network with some insurance companies.
Sure.
Insurance is not all bad, right? And not all insurance is good, just like not all chiropractors are created equal, right? So it's looking at, all right, what is our path? It's creating the roadmap at what we want to do. So practices use ChiroHealth USA all the time as an alternative with some of the insurance world. So there are definite resources that you
Mhm.
could use to do that. So 95% of our patient survey providers surveyed that allowed them to get out of network with insurance. Then there's patient retention. How in the world is it that a discount medical plan, ChiroHealth USA, is better patient retention? Because patients understand the value of care in your office. And why? They love you because they're committed to that. They bring their families in and they refer more people to you. So more than 50% of ChiroHealth USA patients become lifetime patients.
Yes. And that is so true. And I can attest to that exact same thing. And I think there's another component in there. And that component is if you're using it to get off some of the insurance plans,
Mhm.
especially the ones that don't pay very well, or they send out EOBs that have a lot of asterisks and things at the bottom. They're so confusing to patients. It eliminates the EOB,
Mhm.
which eliminates a lot of the confusion about the finances for the patient. Let's face it, the EOB was brilliant from the insurance company standpoint because it kept everybody confused. And so when you eliminate that, all of a sudden the patient's going, oh, it's the same cost every time I go in. I don't get the EOB that says this percentage to that, and this deductible and a co, and this wasn't covered. And oh, look, the insurance it eliminates all that,
Right.
which I think is a beautiful thing. It just brings the relationship back between you and the patient, and
Mhm.
not you and the insurance company and the insurance company and the patient. It eliminates that middle person.
It does. It does. And the cool thing about ChiroHealth USA is that practices get to set their reimbursement. So we're not a network, which is what we operate under that DMPO model as a network. So we jump through all the regulatory hoops, pay taxes, and sometimes in counties, like we go above and beyond when it comes to doing the right thing for the right reason in the right way. But our practices get to say, here are my numbers. Here's what I've traditionally done for cash patients. And then once we do so, a little bit of homework, very light stuff. If it still works for them, then we could keep it. But ultimately, at the end of the day, the practice gets to determine what their level of reimbursement is. So now you're not billing anything. You're not waiting for reimbursement. It becomes the perfect self-pay model. And at the end of the day, it's a win for the patient who could afford the care, is now bringing in their family, and for the doctor who didn't have to wait or negotiate payment.
Exactly. And you just pre-answered one of my questions. And one of my questions was, we get this from doctors all the time. What does ChiroHealth USA pay?
Mhm.
What are they going to pay me for my 98941? What are they going to pay me for my maintenance care?
Mhm.
Well, you set your fees.
Mhm.
You're gonna decide what you get paid. Here's the cool thing. You're not submitting any billing either.
Uh,
It's just direct pay from the patient. No paperwork. And what a time saver that is for your team.
For sure. It reduces the stress. A lot of team members sometimes are hesitant to implement ChiroHealth USA. Sometimes I'll
Mhm.
have the doctors coming in, Heather, we're excited, we're doing this, let's get this going. And then they hand it off to Becky or Susie, someone, and they're just like, oh, are you kidding me, doc? You have no idea what's already on my plate, and you want me to do one more thing? And then you have to have that conversation with, well, here are the rules and regulations. There's a compliance piece. If we keep going down this path, you're risking a lot for you, the doc, and the practice. And then they turn the corner and they implement it. And man, do I love when I get a phone call or and I'm at an event and they're just like, we love you. Oh my gosh, I wish we had done this sooner
Uh-huh. Yeah,
because it just takes the guesswork away. It
sure.
really does. Yeah.
Yeah. Now, did I see somewhere where, I don't know if it was a study you guys did or where the number came from, but something like 50% of patients who are on CHUSA never leave the practice?
Yeah. Yeah. So that's some data that we've got behind the scenes after all of these years is that, and it's 50% or greater. So it's time for us to run that data again, because when I
Yeah.
do talk to practices, they're like, oh no, Heather, it's beyond 50%. Like our CHUSA patients are our most dedicated patients when it comes to compliant care, bringing in their families, and obviously, again, more referrals.
Yeah. And that's what we see as well. And think about this. Okay. So you put one patient on ChiroHealth USA. They have the 3.5 kids in the family, the national average, whatever that is. And so the plan covers everybody in the household.
Mhm.
Okay. So we all want referrals, right? What are the best kind of referrals? Families,
Mhm.
because it's not just one person at a time. It's three, four, five at a time. And then they go to the little league soccer games and they're sitting on the bench and I see so-and-so chiropractor and oh my gosh, they've got this great family membership program. And pretty soon now you've got three other families of five coming into your practice. I've never seen anything that can grow a practice quite the way ChiroHealth USA can. It's amazing.
It's something I enjoy doing because the conversations I get to have, I had a doctor in Virginia who was struggling. She was literally using her savings account to pay the bills. And that wasn't something that she's prepared to do for more than 6 months. And we started working around June of last year and implementing ChiroHealth USA in July, and a slow process to get her going. And then I get the phone call that says, Heather, I need to tell you my numbers. And I put her through the homework side of things. And she said that was the worst part because I had to face the reality of what she had created, right? The number system. And so it's up to you to go build that. But what she told me was super, super impactful. Like the increase in revenue in just a matter of a couple of months was more than 33%. Patients coming back month after month was like 28%, where she was struggling to the point where she, again, was using her savings account to pay the bills. She was less than $200 away from not having to borrow from her savings and paying herself, paying her savings back. And the only thing we did was reevaluate the numbers. We started charging for the services. It is so common for practices to go, "Ah, it's an extremity, it's free." Who cares about that re-exam? I'm going to document that I did it, but I'm not going to collect for it. It's lost
Don't even
revenue.
get me started.
We could probably talk all day on this.
Yeah, don't even
I'm
get me
just
started on that
very
one.
passionate. But when you put an emphasis, it does. No one said that you had to charge $300 for the re-exam. If
Right.
you increase rates by about $5, that could equate to a 13-month revenue cycle, and you didn't have to pay to market, and you didn't have to treat more patients. It was a $5 increase,
Yeah.
and it
Yeah.
makes the world of difference.
And it's that simple. So we need to put a little spot in here for our sponsors, but I want to come back and talk about that just a little bit more and how we think we have to build trust the wrong way instead of the right way. So we're here with Heather Simmons-Ellis from ChiroHealth USA, amazing program. We will be right back. We'll have a quick word from our sponsors, ChiroHealth USA and CATS Consultants. We'll be right back.
CATS Chiropractic Consultants, your partner in chiropractic success. We are dedicated with one-on-one guidance to bring you all your practice management needs. Let's supercharge your practice. Give us a call today.
All right, everybody, we are back. Welcome back to the KC CHIROpulse Podcast. I'm here with Heather from ChiroHealth USA, and we're talking about just all kinds of great things that you can do with a ChiroHealth USA plan in your practice. If you don't have one yet, you are missing out. So contact them immediately and get this going into your office. And if you're not a client of ours at CATS Consultants, we can help you pull this together too, because we look at profitability analyses and things for chiropractors, and these two things just really fit together well. So anyway, enough about that. Before we took the break, we're starting to talk about how you can use this program to really build trust with patients. And we talk about trust leads into loyalty. And loyalty is where you develop those lifelong patients that I call them the patients who stay, pay, refer, and believe in what you do. And those are the patients that we want to build. And you won't build this with everybody. I get that. But you can build this with a really sizable portion of your practice. And here's the cool thing about that. Profitability and practice growth lies on the retention side of practice. Can you imagine if McDonald's only allowed their stores to sell one hamburger to each patron, and that was it? That was their lifetime limit. They could only get one hamburger. No, they set their system up so you want to come back for more. And whatever your favorite restaurant is, why is it your favorite restaurant? Because you like the food and you keep going back. So we want patients to do the same thing. We want to build our business like an entrepreneur, and that happens on the retention side. And so when you put a ChiroHealth USA plan in your practice and you develop the correct strategies to implement it, and Heather's great at doing this for you, helping you with this. When you do that, the loyalty meter goes through the roof. And it's so, I think, counterintuitive for a lot of doctors. I think we get ourselves in that insurance mindset that we can't get away from insurance. We got to use insurance. And I think this is why we have a tendency to give away services. Oh, they're not going to cover an extremity adjustment on the same day that I do a spinal adjustment. So patient needs it. Okay, big part. I get it. Patient needs it. We're just going to throw it in. We're just not going to charge for it. Nails on a chalkboard. I know it is for you too.
Yes.
If you're gonna do the service, you should charge for it. What you do has value, and chiropractors, don't even get me started on that topic. We have more value than any other kind of profession, in my opinion. Not just because I'm a chiropractor, but I'm also a chiropractic patient. But you should be charging for what you do. And Heather, you said this before the outset. You don't have to charge $300 for that progress exam, but charge something. And those small little increments of just charging a little bit. You have interseg tables in your practice. And I know a lot of doctors use them for comfort measures. It just feels good for the patient. I don't really charge them for it. Insurance doesn't cover it and blah, blah, blah. But what if you charge $5 for it?
Yeah.
Are you going to run all your patients off suddenly because you charge $5 for it?
Yeah.
No. But at the end of the day, if you saw 100 patient visits, I'm just doing the math easy, you had an extra $500 that you brought into the practice. Now,
Yeah.
maybe you don't need the money, but now maybe you can donate more back to the community. Maybe you can give staff a much needed raise because they've got families and mouths to feed at home and you want to take care of them too. There's so many great things you can do with a profitable practice.
Mhm.
So I think we have to change our mindset a little bit. And I see ChiroHealth really helping doctors change that mindset in a positive way.
There's a compliance aspect to a lot of what we talk about as well,
Yep.
because compliance is something that every practice has to do. And if you're not being compliant, then I'm not sure what you're doing in practice. But CHUSA ChiroHealth USA is a small piece of compliance in your office.
It
So
is.
we acknowledge that. We hear practices all the time just struggling with one, I don't know how to set my actual fee. I don't know how to charge for that. Heather, oftentimes it's so common for me to just discount additional family members to $1, $5, things like that. There's a compliance piece. And again, you and I could probably go on and have various conversations about a lot of different things, but the trust factor is absolute key and how you communicate care to a patient, the
Yep.
cost of care to a patient, what chiropractic is to a patient is so imperative and it needs to be clean. You don't need a team member fumbling through. I think the cost today is, hold on, let me check. Oh, what is it? Because it sounds like you don't know what you're doing. And if you don't know what you're
Right.
doing when it comes to the dollars, then how do you know what to do when it comes to the care?
Right.
So I'm a firm believer that every doctor, as I said earlier, should never, ever have the financial discussion with the patient, if at all. This is where you need to trust your team, educate the patient.
Exactly.
All of this is so important. Focus on the patient outcome. Tell them what to expect. Share the stories. You guys know this as chiropractors. Patients need a way to communicate their needs. One thing that I think a lot of practices miss is getting the patient feedback,
Yep.
right?
Good
And
point.
do a small survey, maybe every quarter. Why did the patient leave? It may not have been anything happening in the practice. It may have been something in their personal lives. It may have been a financial decision. But if you conduct a small survey, no more than 3, maybe 5 questions, because you don't want to overwhelm anyone. But just get some anonymous feedback. All of that's going to do is improve your practice and set up better patient outcomes.
Yep. Said. So true. So true. What does it cost to set up a ChiroHealth USA program in a practice?
It's my favorite question, and I love to tell doctors all the time, if you really want to cut me a check to cash and mail it to 955 Warriors Trail, Vicksburg, Mississippi, I'll take it. I'll take
Love it.
it. But to be fair, ChiroHealth USA is free. So when Dr. Foxworth set up the network 16 years ago, his goal was to make it so that it was affordable. And what's more than affordable? Complimentary. ChiroHealth USA does this on behalf of the profession. Now, the patients do pay $49. That is a yearly fee. If they join January 1st, it's till January 1st. If it's June 1st, it's to June 1st of the next year. The $49 automatically includes their dependents. So for me, it's my husband and our 4 children. $49 covers our entire household. And we actually are ChiroHealth USA patients. I see a ChiroHealth USA provider
I
because
love it.
I have a high deductible, high copay insurance plan. So it doesn't make sense for me to use my insurance. And that's another path that we could go down. But I truly use ChiroHealth USA. Actually, I'm using it tomorrow to see my doctor. But it's affordable care while you're still being profitable. So cost to practice nothing. We provide the collateral, the training. I work directly with doctors and their team. I want to say hold their hand, Dr. Michael, but I do as much as I can. I've had practices cry. I've had them calling me from the closets in their practice, going, if they know I'm on I've seen it all. And we just love to help. I have an amazing team here at ChiroHealth USA. We're all
Y'all do.
Mississippi girls. So
Y'all do.
outside of Dr. Foxworth, you can't get away from our Southern accent. But we just love to give back. So ChiroHealth USA costs to practice nothing. It makes you money.
What else is there to say? That's just a win. So it helps with your compliance, which that's number one. And doctors, if you're trying to do a discount program in your practice on your own, stop and call ChiroHealth USA. Let's get you compliant right now. That scares me as much as anything in the profession for your practice. So get compliant. But here's the rest of it. It creates a membership program in your practice, which creates more retention. It creates loyalty. It creates brand recognition. It's easy to talk about with patients. You've got all the support from ChiroHealth USA. You've got, there's just so many benefits to it, and it makes your fee structure much more simplified. And if by chance you're thinking about moving more in a cash direction and maybe eliminating some insurance plans here and there, maybe you have some that don't pay hardly anything, or you just don't have very many patients on it. This can be a great tool to help you gravitate away from that. Most importantly, it gets you compliant and it simplifies your fee strategy, your fees in your practice, and makes you more
Profitable discount strategy.
love it.
That's our term for
Love it.
2024. That's what we're doing. With what I'm about to say next, I say very humbling. I know that this may not mean as much to everyone who's hearing or listening to this. Our goal at ChiroHealth USA is to see this profession be number one. Our goal is to give back in so many ways. Dr. Foxworth, and I tend to get emotional over this piece, so you guys aren't going to hear me cry today. He's a phenomenal mentor of mine over the last almost 13 years. But what he does for this profession so that we can see better reimbursements, so that we're more inclusive to healthcare is really astounding. So when I say that we've donated more than $3 million back to chiropractic, funding research, and just seeing where we can get the tide to shift, that's what we do. We work with your state associations, groups like CATS Consulting, to offer an opportunity to do things the right way. So state seminars, you're going to see me there. If it's not me, it's a team member. We're out on the
Yep.
road, and we're putting ourselves out there with you guys to understand better some of the hurdles that you're encountering. But we are very much dedicated to seeing every chiropractor succeed.
You all are amazing, and please pass our thanks along to Dr. Foxworth for everything he does for this profession. And you guys, y'all really do support this profession in a lot of ways. And that's just another reason to go check out ChiroHealth USA when you have a chance out there. So if you're not utilizing their program right now, you should be. So as your coach or possibly future coach, I'm telling you, go do this. Go do this. At least go check it out. Heather, I really appreciate you being on here today. I think we could probably jot down about 20 more topics that we could talk about. So we'll get you back on here soon. And
We could do a lot of this all day. I think,
Yep.
and I hope everyone understands the passion that we have. What I will say to end this is, I know that we need to wrap it up. If you are becoming or a CATS consultant client, I can promise you that you will work with me directly. So
Awesome. We
that's
love
just
that.
a little piece. But honestly, I tell practices all the time. My goal isn't to have you become a ChiroHealth USA provider. My goal is to hear what you're doing and say, you're doing things good. I tell practices, you don't need us more times than they expect. You're doing things the right way. Continue to do what you're doing. Or that's bad. If you tweaked it a little bit and made those changes, you don't need ChiroHealth USA. Or holy smokes, that is totally illegal. Stop what you're doing right now. Let's tweak and fix all of this. You absolutely need ChiroHealth USA. So that genuinely is my approach. It's not something everyone needs, but we're happy to figure out if you need it and how we can increase all of the numbers and things that you and I have talked about today.
Absolutely. Y'all are really, truly wonderful at that.
Thank
So,
you. Thank you.
all right, everybody. Heather, thank you for being on here today.
Absolutely.
Dr. Foxworth, we said hello. And for everybody out there, if you haven't done so yet, go to catsconsultants.com. Check out all the great things we're doing. There's free downloads and things on there. And Heather, how do they get a hold of you guys?
Simple. Just shoot me an email, heather@chirohealthusa.com, and I will help you out.
Beautiful. And I'm telling you, y'all, Heather is always there for you. All right, I don't think I have any other announcements. So thank you, everybody, for tuning in to this week's episode of the KC CHIROpulse Podcast. Subscribe to the podcast, tell your friends about it, and we will see you all next time. Have a good one.